Hi, I am Dr. Sai Kumar. I am consultant medical oncologist in Bagchi, Shankara Cancer Center and Research Institute, Bhubaneswar. And we all know that cancer is one of the deadliest disease which humanity have ever faced. And unfortunately, the incidence of cancer is rising day by day. So this deadliest disease may require multiple forms of treatment for controlling it or to cure it. So the main modalities which are required for treatment of cancer are surgery, chemotherapy, radiation and pain and palliation, which basically deal with the symptom management. So today I will be discussing about the role of chemotherapy in the cancer treatment. So chemotherapy is basically the drugs or medications which we give in the form of injections or the drugs majority of the times, and the intention of chemotherapy is either to cure the disease or to control the disease. If we are giving chemotherapy to cure the disease, it is basically called as curative intent chemotherapy, and if it is given to control the disease and improve the quality of life, it is called as palliative chemotherapy. So chemotherapy can either be given alone as a treatment for cancer for some cancers. So either as alone or in combination with other forms of treatment. So if it is given with the primary modality of treatment, it can be either given before the primary treatment like surgery or radiation, or it can be given after the primary treatment, or it can be given along with the primary treatment. If we are giving the chemotherapy before the primary treatment, it is called as neoadjuvant treatment, and if you are combining the chemotherapy with your primary modality like radiation, it is called as concurrent chemotherapy, or if you are giving after your primary modality of treatment, it is called as adjuvant treatment. And if you are for many patients like those who are having incurable disease, we used to give chemotherapy to control their symptoms and to improve their quality of life, which is called as palliative chemotherapy. Depending upon the dose of chemotherapy, the injection, we divide it as high dose chemotherapy or standard dose chemotherapy. Majority of the times patient may require only standard dose chemotherapy, which is delivered in daycare basis, which means patient can come to the hospital, can take the chemotherapy. The whole procedure will take around 4 to 6 hours and they can leave the hospital. But for few cancers require high dose chemotherapy, which require admission in the hospital. They should be in the hospital during the course of treatment, as well as we have to observe them for few days or weeks to to see the complication and as well as to manage the complication and to see the response. So most of the times patient will ask whether chemotherapy is painful. It is a misconception that the chemotherapy, the process is painful. It is like any other medication which you receive through an intravenous cannula. So most of the time the process of taking chemotherapy is painless, and majority of the patients can complete chemotherapy within 4 to 6 hours. So the problem with chemotherapy is not in receiving or administrating chemotherapy. It is regarding the after effects or the adverse reactions which occurs after taking chemotherapy. So most of the patients who are receiving chemotherapy are at a high chance of having immunosuppression and the complication associated with immunosuppression. So the patients who are taking chemotherapy should be aware of the fact that they are prone to develop infections. So they should take particular precautions to avoid getting infected from others. They should take the following precaution. First, regarding their diet, the diet we call it as neutropenic diet. That means that the food that they are consuming should be well cooked and clean. They should not take food which is uncooked and raw. And regarding water which they are consuming, it should be well boiled and cooled water. And the most important thing is they should avoid visiting them in their house after having chemotherapy, because they can bring various forms of infection to them. So these are the three most important things which they have to keep in mind while undergoing chemotherapy. Then other complications which we are worried about are like nausea, vomiting, which happens with most of the chemotherapy. Nowadays there are a lot of drugs are available to control the symptoms, and most of the female patients are worried about their hair loss. So majority of the chemotherapy drugs have hair loss as their side effect, but we have to understand that this is not permanent, it is temporary. Most of the times once your chemotherapy is over, your hair will start regrowing. So there are certain side effects which we should be there are certain side effects which are avoidable or preventable, like preventing the infection, and there are certain side effects which are unavoidable but it are reversible. So most of the times the cancer patients who are taking chemotherapy, if they have any signs or symptoms of infection, like if they are feeling uneasy, they have to consult their doctor immediately, and it is not like you can wait in your home and you can consult your doctor for the next chemotherapy session, because most of the times they are immunocompromised, so the chance of them having severe infection with mild symptoms is very high. Our Department of Medical Oncology is well equipped with all the facilities which is required for safe administration of chemotherapy and to monitor you during the session, as well as to manage the complications. So in the fight of cancer, our Department of Medical Oncology and Bagchi Cancer Institute is with you throughout, from your day of diagnosis up till your follow-up. Thank you.